Path Medicine, a guide for the medical student who likes to ask why. In this video today, we're going to talk about post-operative ileus. Post-operative ileus is a really important surgical complication to be aware of. This is because it's very common, it can cause patients a lot of distressing symptoms, and it can result in prolonged hospital stays. For the purposes of this video, we're going to split post-operative ileus into different categories that we will discuss. The first is we'll talk about how we define post-operative ileus. The second will delve into the underlying mechanisms causing this condition and how we can use those to help us remember the risk factors for developing this condition. And finally, we'll finish off by talking about how we diagnose and manage post-operative ileus. So now let's talk about how we define post-operative ileus. Post-operative ileus, there currently is no internationally agreed definition. So when we're going to talk about the definition of post-operative ileus, we'll first consider it as a concept so we can understand the concept of the condition, and then we'll talk about the clinical factors used in the various definitions proposed by academics but not currently agreed upon. So let's start with as a concept. So post-operative ileus, the first word is post-operative. So we know it's a complication that we have after surgery. And in particular, abdominal surgery will give you the highest chance of developing post-operative ileus. The second is the term ileus. So ileus refers to an impairment in gut contraction. So post-operative ileus is a surgical complication where the gut isn't able to contract effectively. And because it's not able to contract effectively, it's not able to propulse feces as quickly through the bowel. So to get from point A over here to point B takes a longer time, and we refer to that as an increased bowel transit time. Now, what distinguishes post-operative ileus from other causes of ileus is that in post-operative ileus, there is no mechanical obstruction. So there's no physical obstruction point. It's simply the fact that there's an impairment in the general gut contraction and the coordination of contractions. Clinically, the factors used in defining postoperative ileus relate to the fact that you have an impairment in bowel transit time, and now, for example, all the feces here is starting to accumulate. And so for a patient, that's going to cause symptoms of nausea and vomiting, and they won't be able to tolerate an oral diet because their proximal portion of their bowel is still full of feces. And if it gets bigger and bigger because of the backflow, that will then cause abdominal distension, and the fact that you have a backflow in the system is going to cause a symptom of constipation. So these are generally all the factors used in the various definitions of postoperative ileus. Now let's move on to how we classify postoperative ileus. There are two ways of classifying postoperative ileus. One is based on the duration of symptoms, and the other is based on the underlying cause. So in terms of duration of symptoms, the only definition you need to know is that we define it as prolonged postoperative ileus if the symptoms that we mention here in the clinical factors last for 4 days or more. That's where you refer to as prolonged postoperative ileus. Now let's talk about the etiology. So we can define postoperative ileus as a primary postoperative ileus or secondary postoperative ileus. Primary postoperative ileus is where the surgery alone is the causative factor for developing the ileus. There is no underlying condition that's promoting the patient to develop postoperative ileus. Whereas in secondary postoperative ileus, there is an underlying condition. And the best way to understand the different secondary cause of postoperative ileus is to first consider fluid. So we know that having large amounts of serous fluid is one of the underlying causes of postoperative ileus. Now, if that fluid accumulates, it can become infective and therefore become an abscess. So that's the second of the underlying causes of postoperative ileus. And finally, if you think of that fluid can leak. So if the person, for example, has had a surgery where they've joined two bits of bowel together, which you can see here, sometimes that join may become ineffective for whatever reason, for example, inflammation, and that can cause a leakage of fluid, which we call a post-anastomotic leak, and that's another cause of secondary postoperative ileus. Now that we have a clear understanding of how we define and classify postoperative ileus, let's delve into the underlying mechanisms causing postoperative ileus. And the best way to think of these is to split them into three categories: factors related to inflammation, factors related to underlying neurology, and pharmacological agents. So let's talk about inflammation. So in any cell, if you have tissue damage, so damage towards the cell, it will cause the release of specific markers of damage, which are referred to as damage associated molecular patterns. So, in the case of having surgery, naturally you're going to damage tissue and damage cells. So, you're going to get a release of these damage associated molecular patterns, which we call as DAMPs. Now, those DAMPs can then be picked up by immune cells. And for the bowel, it's in particular, it's peritoneal mast cells and macrophages. And so those DAMPs bind onto those receptors and it stimulates these immune cells to release cytokines. And the cytokines indicative of inflammation are interleukins 1, interleukin 6, and TNF alpha. And those cytokines can do a lot of things. And one of those things that they can do is that they can start binding onto other immune cells. And therefore, as you can see now, you've got the recruitment of more immune cells to the area of damage, i.e., the area you have surgery. Now, these cytokines, for many mechanisms, can result in ileus. And to just give an example of one, is the presence of gut wall edema. So we know cytokines, as well as the hormone histamine, which is also released in inflammation, causes blood vessels, as you show here, to become more permeable. So that means they leak more water. So you can see lots of water is starting to leak from those blood vessels. That water, in essence, gets spread within to the interstitial fluid, and that causes gut wall edema. Now, having lots of gut wall edema, lots of fluid in the gut wall, can physically generate pressure, which can cause compression of blood vessels. And those compression of blood vessels means those cells, those smooth muscle cells that are contracting, don't have those nutrients to contract, and therefore you get an impairment in gut contraction and therefore development of ileus. Not only that, that physical pressure over here can also start to damage the smooth muscle cell cytoskeleton. And if the cytoskeleton is damaged, the contraction is impaired. And finally, if you think about it, if you have a bowel, so for example, you have the bowel wall here, if you're physically putting pressure on the bowel wall, it impedes the flow of the contents through the bowel. And then that's what we call as another factor that's going to impair the propulsion of feces, increase bowel transit time, and thus lead to the development of post-operative ileus. Now let's talk about some of the neurological mechanisms. So if we start with the autonomic nervous system. So the autonomic nervous system is split into the sympathetic nervous system and the parasympathetic nervous system. The parasympathetic nervous system exerts a positive force on the enteric nervous system to stimulate smooth muscle contraction, whereas the sympathetic nervous system exerts an inhibitory force which causes smooth muscle relaxation. So we know with postoperative ileus, because of the generation of the inflammation, so because of all these cytokines here and that inflammation, it can cause a switch in the balance such that the sympathetic nervous system starts to outweigh the parasympathetic nervous system, and so that will impair smooth muscle contraction, causing the development of ileus. That's generally what is considered the mechanism in terms of neurology. However, other academics have also mentioned the fact that in certain cases it can cause bowel wall hyperactivity, and that can cause a functional obstruction. So again, looking at the diagram here, if for some way the inflammation is able to cause bowel wall hyperactivity, it can cause a functional obstruction, because if, for example, this part is constantly contracted, it's a smaller gap for all the feces to travel through. So that is something that other academics also claim. But generally, it's the idea that the sympathetic nervous system starts to outweigh the parasympathetic nervous system. Now, the final factor in terms of the underlying pathophysiology refers to pharmacological agents, and they work by affecting the nervous system. So the first and the most obvious one are opiates. Opiates, such as morphine, act on mu receptors within the enteric nervous system, and they exert an inhibitory force, and that's going to cause smooth muscle relaxation, so you're not getting that contraction, so you're not propelling feces through the bowel. Additionally, anesthetic agents can also be implicated into the generation of postoperative ileus. This is because what they can do is they can affect the ability of the enteric nervous system to cause smooth muscle contraction, so they affect at this point. And anesthetic agents work by interfering with the transmission of ions through nerve cell membranes. Now, the colon cells themselves lack gap junctions, so gap junctions allow the flow of ions between the cells. So you've got like a secondary mechanism, so you can have the flow of ions to cause depolarization between cells. Because the colon lacks these gap junctions, they're going to be more dependent on these nerve cells for stimulation. And because the nerve cells are being affected by these anesthetic agents, by impairing the flow of ions across the membrane, it means that anesthetic agents can have a big impact in causing the development of postoperative ileus. And just to be aware, this is one of the mechanisms of anesthetic agents, but anesthetic agents have other mechanisms to cause postoperative ileus, for example, by causing smooth muscle relaxation. So that's a general overview of the pathophysiology of the development of postoperative ileus. For a comprehensive guide of all the information covered in this video and more, please be sure to check our blog at navmedicine.wordpress.com. Thank you.